Yeah. Um, Hi everyone. So I think we're going to kind of kick things off. Um, I think there are a few more people hoping to come, but we'll record this meeting. Hopefully people can kind of catch up and watch it in their own time. So first of all, thanks for coming, everyone who's here. Um, it's myself, Sam, and Janelle who've kind of been working on this project. So just to introduce myself for those of you who don't know me, I'm Kim. I'm an ambassador for PIP UK. I'm also a medical doctor working in London at the moment. And yeah, with the help of Sam and mainly Janelle for all her hard work as well, we've kind of put together this project, which is kind of one of the first kind of research projects, I suppose, that PIP UK has kind of undertaken. Sam did one with the registry as well, but as we all know nowadays, kind of moving things forward is often sort of data driven, and we're hoping to kind of produce more research. This being like the first of many, hopefully, to help us pull together information and yeah, use it to help people with Poland syndrome in the UK. So I'll kind of crack through this presentation. I'll outline kind of what we've done and the project and kind of what our the key findings were, and then kind of where we're hoping to go with things. And then I'll open it up to the room for kind of your really valuable input. Obviously, this is I think everyone here kind of either sort of have Poland syndrome or know someone who has Poland syndrome. So yeah, anything you have to say and kind of any opinions you have would be we'd be really grateful to hear them. And yeah, positive or negative about the project that we've done, just yeah, feel free to kind of talk out once I've finished. Um, so we wanted to focus on chest surgery because, as we know, kind of for people with Poland syndrome, surgical input is one of sort of the major contacts with healthcare that you have as someone with Poland syndrome. Um, Chest wall surgery amongst people with Poland syndrome is kind of one of the more divisive topics, I suppose, for people with hand disabilities like myself. I had a hand operation when I was younger. They're kind of a bit more straightforward because they offer a very clear kind of functional outcome, I suppose. But with chest wall surgery, the it's a bit more grey, I suppose. And the decision making around surgery and the way people feel about their surgery is something that we were kind of really interested in. So I won't kind of go through this bit. This is kind of just what Poland syndrome is, but I'm sure you kind of all know that. So I'll kind of skip through kind of these slides um, and move kind of straight on to our research project. So, sorry, gone ahead. So, like I said before, our project. Oh, sorry. Do you know how to stop it just skipping through?
Oh, I'm not too sure, Kim.
Maybe I'll one sec. Hmm. Might just show it like this. Is that all right? Because then it'll stop.
Sure.
Is
Okay.
that okay? Um, yeah, so basically, yeah, our project was looking at kind of patient reported outcomes and themes evolving around sort of chest wall surgery. Um, so we kind of took a patient and public involvement, so a PPI kind of approach in this process. We wanted the research to be sort of carried out with or by members of the public, rather than to or about or for them, if you like. And we kind of wanted the people with Poland syndrome to have the biggest say and kind of directors in the kind of the direction we would be going in. So this is kind of our inclusion criteria. So essentially, you had to be someone who has Poland syndrome, and then we kind of split it into a few different groups. So we were looking at people who were offered chest wall surgery, or people who were a parent or a person who had been offered chest wall surgery as well. You didn't necessarily have had to undertaken that surgery. So yeah, it was just basically had you been offered it at some point. So some people will have been, and some people won't have been. And then aside from that, it was also parents of people who have been involved with chest wall surgery for sort of their children with Poland syndrome as well. So when we kind of started out, we thought kind of the best way to kind of approach this project would be sort of through focus groups. that would be kind of the best way for us to sort of naturally and organically kind of draw out the key themes that affect people going through chest wall surgery, or those decision making around whether they're going to have it or not. Because we kind of when we set out with this, there's very little kind of research or studies around this sort of at all. I think this is kind of one of the first projects that's been undertaken in the UK anyway, that kind of looking at this topic in particular. So we employed a semi-structured list of questions. So we kind of sat down together, had to think about what some of sort of the interesting questions might be that we could, to get like a good dialogue going within the focus groups, and to try to create a bit of consistency through those focus groups as well. We kind of wanted to have a look at the perceived sort of physical and psychological outcomes of having or not having the surgery. And we're obviously also really interested in kind of the gender differences related to having the surgery or not. They're kind of the reasons for surgery. We assume we're probably going to be quite different between men and women. There would be some crossover as well, but we wanted to kind of see that difference between men and women during these focus groups as well. So in terms of kind of the data analysis, once we had sort of completed the focus groups, I think we had sort of 3 or 4 different focus groups over sort of a 4-month period or so, as and when we could kind of get people together in the kind of correct groups. The Each group was sort of recorded and then transcribed and anonymized as well. And we used AI on one side to kind of generate some of the key themes that had come from the focus groups that we performed, and get an idea of kind of what basically what AI had thought. And then we kind of compared that to a human-led sort of approach. So that was with myself, Sam, and Janelle, kind of going through the transcriptions with a fine-tooth comb, and picking out the key themes ourselves, and seeing what that crossover was with AI as well. So looking at the kind of participants, we had 11 participants overall, which was kind of a really good turnout. Kind of getting people involved with these kind of research projects can be quite tricky, because they take a little bit of time and organization to get everyone together. So we were really pleased to get 11 participants. The majority were female. And that was 72% of them. They were aged kind of between 22 and 65. And in terms of just sort of their general kind of background, all self-identified as white with ethnic origins. Mostly they were British participants, so 63%, but we also had people from overseas. So we had American, Belarusian, and also French as well. Their kind of surgical experiences were heterogeneous, so they varied basically. I think when we kind of set out on our journey, we maybe wanted to look a little bit more at kind of the lap door side transfer surgery. But actually what we found, that I think, given that this was kind of one of the first studies of its time looking at chest wall surgery, we kind of quite quickly realized we needed to kind of open it up to include all the different types of chest wall surgery that kind of people with Poland syndrome undergo. And again, this is quite important in terms of the gender differences, because females obviously undergo quite different chest wall surgeries sometimes to males, with the females looking more specifically at kind of sort of crossover with kind of breast surgery with implants, not just that kind of muscle graft and chest wall surgery as well. So these were our kind of main findings. We kind of drew out sort of 6 key themes, which you can see there, and we've kind of grouped them into 2 main groups. So self-esteem and body image, feeling medically othered, which I'll kind of talk about in a little bit. Inconsistent treatment, continued inconsistent treatment in terms of outcomes, empowerment around their surgical decision making, and then a lifetime of surgery. So people having to undergo multiple surgeries or redo surgeries without actually kind of that knowledge of knowing they may have to go through that process if they start down that road. And then within each of these kind of these 6 themes, we identified some sub themes that kind of came out of all those things. So as you can see there, I'll pick out a few. So things like gender pressures in terms of self-esteem and body image, they seem to differ quite a bit kind of between male and females, sort of understandably. Um, the kind of agency and communication between different healthcare groups. That lack of consistent care over time is something that came up quite a lot, and I think something that kind of lots of people with Poland syndrome have sort of anecdotally I've spoken to them about is that kind of being bounced around different areas of healthcare over a long period of time, having long periods of time where they don't have a lot of contact with healthcare as well, feeling a little bit lost in the system seems to be quite a sort of quite a common finding, and that was true for our project as well. So anecdotally talking to people seemed to, from what I kind of gathered, seemed to fit in quite well with kind of the findings that we had. The themes were kind of quite similar. So I'll talk through kind of some of the themes a bit more individually. So self-esteem and body image, we put this as kind of one of the main themes because this was really consistent kind of throughout the project, is that the different impacts, I suppose, that having the surgery can have. There were some kind of really positive feedbacks in terms of improving self-esteem and improving body image. And yeah, we've included some sort of like for like quotes that kind of were directly said. So for example, Meredith on the bottom, I feel like a part of being a woman is having two breasts. And so like, if you don't have that, it feels almost like it impacts your identity as a person. And there were lots of kind of really, really powerful quotes and outcomes. And just to say they're not the actual names of the participants, by the way. In terms of sort of self-esteem, body image, looking at kind of male participants, in some ways it was sort of a similar thing for females wanting to feel feminine. It's also for males kind of wanting to feel that kind of masculinity, I suppose, of having pectoral muscles and looking like people look like in the gym if they work out, lots like Arnold Schwarzenegger, if you like, as commented by George here. So the sub theme, kind of the second sub theme under sort of self-esteem, body image, we're looking at like the mental health impacts of Poland syndrome. Again, this is something that I've come across kind of a lot just speaking to people throughout sort of PIP-UK and my involvement there. Shows that the mental health impact of Poland syndrome is sort of heavily talked about within our focus groups. Obviously, it's kind of a surgical sort of problem, if you like, in terms of the actual contact that you have with, as someone with Poland syndrome has with healthcare, is generally it's with a surgeon, because it's the surgeons who offer the actual kind of interventions. But the mental health sort of consequences of having Poland syndrome and looking slightly different was something that came up sort of time and time again throughout. That kind of led us quite nicely on to sub-theme 3, which is kind of a lack of mental health support, which I think we all know is really, really important for anyone kind of undergoing surgery. But there was an identified lack of mental health support for people with Poland syndrome and people undergoing surgery and along their surgical journey, and in terms of just help, like having help to make those decisions to undergo the surgery themselves. And having that mental support sort of both before surgery and both after surgery, it did seem to be sort of quite lacking from what people said to us. So this was kind of theme 2, so kind of feeling medically othered, if you like, and sub theme 1 for that was sort of a shared uncertainty, I suppose. Among a lot of participants, there was a degree of uncertainty sort of around Poland syndrome. Many sort of described the physical effects of Poland syndrome by naming affected muscles, whilst others reported sort of not knowing that information in full, and others described sort of not even knowing the etiology of Poland syndrome. And then there was quite a clear kind of healthcare professional lack of knowledge, I suppose, around Poland syndrome. That was also kind of quite widely reported. And they can make for sort of quite alienating sort of medical experiences, we found. So people kind of commented that they would have doctors sort of Googling the condition in front of them whilst they were sat there. And there was a general lack of knowledge about what Poland syndrome is among the medical community. I can kind of corroborate that myself as a doctor. Lots of sort of my colleagues, people I work with, have no idea what Poland syndrome is. And that's not necessarily their fault because it is a rare condition, and sort of they can't necessarily know all of the rare conditions. But I think that the way medical professionals approach not knowing necessarily what they're talking about can sometimes be quite alienating, because I think doctors sometimes feel they need to come across as people sort of who know everything and have all the answers. And actually, that can make for some quite poor consultations and poor medical experiences. Um, yeah, so this was just a little bit about what I was talking about sort of participants commenting that they would have sort of doctors just Googling in front of them, telling them lots of facts which weren't necessarily correct, which was quite upsetting for them, and made them lose a bit of faith, I think, in the doctors that were treating them. Sometimes people commented that they were treated as a case study for the people kind of with Poland syndrome here now. I'm sure that that's something that you've come across, is kind of always being brought in for medical students, people sort of ogling you and sort of examining you for kind of educational experience. And that's not something that was always particularly pleasant, I suppose, for people who have a condition that they're struggling with and are trying to find their way. Being used as a case study is not something they always necessarily sort of appreciate. Theme 3 was kind of inconsistent offers and care. So we know that this is an issue kind of within Poland syndrome, and this is something that kind of came out within our focus groups, is that really it kind of depends where you are in the country. It depends which surgeon you go and see. And there aren't sort of clear treatment pathways that are sort of been laid out sort of specifically by NICE or by NHS, which they do have in sort of more common conditions. So people with Poland syndrome offered different surgeries, different levels of care, and it all feels fairly random, just depending on who's going to be treating them. Some participants sort of felt they had to stand up for themselves in order to gain the care that they wanted. This was also something that kind of this came up quite a lot. For example, if you wanted an operation, but it was mainly for a cosmetic reason, which actually, is just as important as for a functional reason. They felt that they had to kind of fight for that, rather than it being kind of an open dialogue about why they might necessarily want that for cosmetic reasons, if you like. There were some positive experiences with healthcare professionals, which was nice to see, that kind of centered around choice. Some people commented that they kind of were given the options, they were given the pros and cons, they were given time to think about it, and I suppose that shows how it can be done well and done properly within the healthcare setting. Is giving people sort of all the option. That is how kind of ideally we should be aiming to operate as physicians, is giving people all the options, telling them all about it, and basically being a guide rather than telling people specifically what what should happen or shouldn't happen. Theme kind of 4 is that sort of continued inconsistent care. So looking at kind of sub-theme 1, this upwards comparison, with women's surgeries often taking place kind of within clinics used primarily for breast cancer patients. Some participants reported kind of upwards comparison as part of their kind of surgical recovery experience, and in how Poland syndrome is treated, within the healthcare system. So they would comment that, for example, they would be on wards after surgery with people who had surgery kind of for breast cancer, and I think that kind of it just kind of made it feel like that kind of continued care was fairly inconsistent. And then looking more into that kind of lack of consistent care kind of over time, this was a kind of another sub theme that got pulled out in terms of continued inconsistent care. Is that people were bounced around. People spent large kind of periods of their life without any contact with healthcare, without any kind of input, and not really knowing how to be plugged back into the system. I suppose if you needed kind of further consultation, or you were struggling with something related to the surgery that you had, or potentially you were offered surgery before, which you chose not to undergo, and then what if you then wanted to kind of follow that up later down the line, it was quite difficult for patients to kind of follow that through. So theme 5 was kind of all around empowerment, I suppose, and that's kind of empowerment in terms of making their own decisions around the surgery that they were going to or not going to have. Kind of patients who decided on surgery were sort of largely satisfied in terms of what we found, which was really great. Sometimes they were satisfied with the surgery that they'd had, but not necessarily the kind of the care that had gone in around it, if you like. Lots of people kind of reported that they had enhanced confidence, which again kind of feeds into that kind of the body image and self-esteem theme that we pulled out. And many people kind of described it as life-changing and having that kind of sense of relief compared to how they felt kind of pre-surgery, if you like. Yeah, and this kind of again, this kind of enhanced confidence was still appreciated, kind of even in the rarer cases where participants were left without implants, or even after sort of numerous surgeries, where from the outside, I suppose it might look like that would have been something that was really difficult and maybe they wouldn't have had a positive experience, but actually, despite kind of bumps along the way, some of them still kind of commented that they were still kind of really grateful that they went down that road and they'd actually still had sort of really positive sort of confidence outcomes. People talked a lot about kind of clothing as well, and clothing kind of adaptations in terms of hiding their Poland syndrome and how that had kind of that changed, I suppose, once they'd had the surgery. Kind of notably, participants who did not have the surgery also kind of described sort of empowerment over time. So if we look at kind of some of the kind of more specific quotes here, someone said, "I feel like if I could get over like this birth defect, I feel like I can take on a lot more things now, and it's given me a lot more confidence." So I guess as people kind of move through their lives, whether they had surgery or not, they can develop that confidence themselves. The final theme that we pulled out was kind of a lifetime of surgeries, and this was quite an interesting one, I found, because it's not something that I kind of expected, I suppose, because I think in my head, maybe naively, I thought that once you'd had the chest wall surgery, that would kind of be it. But I hadn't kind of considered some of the different surgeries that might have been undergone. So particularly with implants, they don't necessarily last. Surgeries have to be done and redone. If you're not happy with the surgery, if it's mainly been done for a cosmetic reason, it may have to be redone, because if it doesn't look how you would like it to, then the kind of the point of the surgery was lost. So that was a kind of a key theme that was pulled out, is that lots of people do have to undergo kind of a lifetime of surgery, if you like. There were some kind of reports of difficult recoveries and adverse outcomes. So that was one of our sub themes for a lifetime of surgery. So this could be kind of a whole paper in itself, which would be actually quite interesting to look at, because it'd be quite useful for people who undergo it prior to having surgery, if they know some of these sort of adverse outcomes. Because I think when surgeons explain things, sometimes they kind of brush through some of the adverse outcomes, and actually some of them are really important. So things like the formation of scar tissue and calcification around the implants, or breakages of implants. I think one even commented that they'd suffered a pneumothorax following the operation, infections, loss of nerve feeling, and that kind of day to day as well, just that feeling of like coldness in terms of having an implant in. And they were often sort of complications that were unexpected, and people weren't expecting to feel. And they did comment that sometimes they felt like this hadn't been kind of talked through properly and clearly in terms of what could potentially happen to them. So just carrying on in terms of complications and adverse outcomes, sort of for patients who didn't choose a surgical pathway, concerns over sort of the adverse outcomes contributed to their decisions to not have surgery as well. So they were kind of all our kind of main themes, and then we kind of pulled it all together in kind of into a discussion to kind of try and think, I suppose, how this research sort of impacts chest wall surgery decision making with people with Poland syndrome, and then also where we can go from here. I think kind of one of the key things is that this is a very early kind of first project, if you like, and the main kind of point of it was just to get the ball rolling and also to draw out some of the key themes that we could then go and explore in a bit more detail in kind of further papers. So I think some of the kind of key points we've just kind of pulled out here is that although Poland syndrome is primarily a physical condition, the mental health aspect and the consequences of that is something that sort of can be a motivating factor for surgery, and that there should be sort of very clear supported psychological care, which some people reported they did have, but many people didn't. And I think that that's something that is really important, especially when you're considering undergoing a surgery that you don't sort of functionally necessarily need to have to live your life. I suppose that psychological care is really important. Findings also suggested that the choice for surgery may be influenced by sort of inconsistent care. As we mentioned, there's a huge range of surgeries that people can have, and different surgeons will do things in different ways depending on sort of how they've been trained and where they practice and what surgeries they do sort of within that unit. And those kind of that range of options can be is not always consistently presented to patients. I suppose ultimately patients report that surgical results have positive impacts on their mental health, which was actually kind of a really good finding, I suppose, if you like. I shouldn't say good or bad findings, but that was something sort of really positive to hear. And it was sort of a satisfying and key motivation for surgery. Yet empowerment has outcome for surgical decisions. It's not limited to patients who have chosen a surgical pathway. So patients who chose not to have surgery, I suppose, also felt empowered over time, and that was also a really interesting finding. I suppose if you are offered the surgery but you choose not to have it, and you have those open sort of dialogues with the surgeon and you talk through all the pros and cons, actually, if that's done well, that can actually help you to feel empowered over time and to feel more comfortable with not having the surgery and with kind of the way your body looks at the moment. That actually can actually help people sort of get over that sort of disability barrier, if you like. Beyond aesthetic changes, which were important to participants choosing surgery, the only other kind of positive physical outcome reported with a small number of patients was that sort of feeling of enhanced protection, I guess, if you like. I know sort of some people feel like without having that sort of pectoral muscle mass, sometimes they almost feel like a bit vulnerable, if you like. We didn't focus that much on kind of actual sort of physical and functional outcomes. It's a very sort of wide and broad topic and something we'd really love to explore. But that's kind of one of the only real physical outcome that was reported from this project, I suppose, was that feeling of enhanced kind of protection. And then finally, kind of many participants experience sort of unpredicted adverse physical consequences and the need to redo surgeries. And I think that was a kind of a really important point. And I guess something that if you're going to be undergoing chest wall surgery, something that definitely needs to be clearly discussed with the surgeon so that you're prepared for that potential outcome. Because I think a lot of people who then had to undergo redo surgeries and had those kind of consequences of the operation didn't always feel like that had been sort of clearly explained. They weren't necessarily prepared for that, I suppose. So moving forward, we kind of want to build on this record of patient perspectives. We want to kind of try and help improve surgical pathways for people with Poland syndrome. And even though it is a rare condition, it's still something that's really important, and we want to kind of make those surgical pathways a bit more standardized, I suppose, and make sure that they have all the care that they could possibly have surrounding it. Because I think clearly, kind of having talked through everything I've talked through, one of the key things that's come out of this is sort of good communication, and that open and sort of honest dialogue between physician and patient is something that makes all the difference when it comes to sort of making that decision around surgery, whether they have it or whether they don't. We need sort of further research to explore kind of the functional benefits of chest wall surgery. For that, we're going to need to look more specifically at specific operations. So that could be sort of potentially a bit more challenging in terms of having enough sort of people and participants to kind of push that research forward. But that's something that I'd kind of be really interested in the future in looking at, is the actual sort of physical functional benefits. There were some limitations. So I know that, we were pleased to get 11 because it is hard to get people, especially with rare conditions, despite our kind of access to our charity and all our amazing people within PIP-UK, but participants were quite few in number. There was a very large sort of range of experiences. People had completely sort of different operations as well, so sometimes comparisons can be difficult to make. The majority were female, so we're hoping to get a few more males as well. So in the future, that be a direction that we go in as well. Kind of moving forward, the kind of so building on this principle, kind of the collaboration stemming from this project has resulted kind of in community and academic partnership. So we presented this at the ADIRA conference. Janelle presented it, and that's kind of really exciting, is to have something, I suppose, to present from a Poland syndrome point of view, to sort of medical professionals in that kind of medical sphere, is really going to be the best way that we can push the case forward for people with Poland syndrome. As I've said, kind of Poland syndrome it's a rare condition, so raising money and sort of encouraging sort of the powers that be, I suppose, to get involved with Poland syndrome and to invest in Poland syndrome and all of these different kind of things that we would like to happen for people with Poland syndrome, can be really, really challenging. And the way that we will do that is sort of through data-driven hard evidence that we can actually bring to the people that make decisions to help us push our case forward. So I think that kind of brings me to the end. Sorry, I've spoke a lot. I feel like it's been I hope that kind of that all kind of makes sense. And happy to open up the floor to any questions. Anything anyone has to add would be really appreciated. So thank you.